Hi, I'm Emily, and my group and I are going to talk to you about a virus. This virus is insanely common. It's actually one of the most common viruses that affect humans. In fact, 50 to 80% of people in the US are infected with this virus. And the virus that we're talking to you today about is the herpes simplex type 1, and people often refer to it as cold sores. We want to give you a little bit of history about the virus. Herpes have been said to have infected populations as early as the Middle Ages. The word herpes comes from the Greek word herpein, which means to creep. The Greeks described herpes as sores that creep along the surface of the skin. So the reservoir for the herpes simplex virus are humans and animals. There can be in both humans and animals, but humans are the only ones that show symptoms. So they are the only ones that show signs of the disease. So the name of our virus is herpes simplex, and it's type 1 that we're talking about. It is an enveloped virus. The genome of the virus is double-stranded DNA.
I'm Casey Albright, and our group is continuing with the herpes simplex virus type 1. We're going to be going over some of the signs and symptoms. So some of the signs are cold sores, fever blisters around the mouth and on the face. They can be found on the lips, the gums, the throat, front of the tongue, or the cheek. When someone is infected with the type 1 virus and they are performing sexual activities during that time that they're infected with that virus, it can lead to genital herpes, which include blisters in the genital areas. Along with this virus, if you touch someone's cold sore, if you touch your own cold sore, and then you touch your eyes, it will lead to a disease called herpes keratitis. It causes eye pain, discharge from the eye, and a gritty feeling in the eye. The sores result from ruptured blisters. And then some of the symptoms that are associated with the herpes simplex virus type 1 is you have tingling and burning prior to the outbreak, flu-like symptoms such as fever, swollen lymph nodes, muscle aches, headaches, tiredness, and lack of appetite, pain during urination, that is with genital herpes, and then itching. So we know that the transmission is person to person, direct contact, and that's bodily fluids being transferred from either you, the affected person, or from the infected person to yourself. The ways that those are transferred is through kissing, sharing the same utensils, sharing lip balm, and some of the other ways that it is transmitted is through oral sex, and that's the signs and symptoms and the transmission of the herpes simplex virus type 1.
Hi, my name is Brennan Puida, and I'm going to be talking about the treatment and prevention of herpes simplex 1. According to the Center for Disease Control, or CDC, most people who have herpes simplex 1 do not even know that they have it. This makes treatment and prevention a little tricky. There is no cure for herpes simplex 1, and there is no vaccine for herpes simplex 1. There are, however, a few antiviral drugs that can help. These drugs, taken orally on a daily basis, can shorten an outbreak and lessen the frequency of outbreaks of herpes simplex 1. Also, many people use antiviral creams and ointments to relieve the itching, burning, and tingling that is associated with herpes simplex 1, especially for cold sores or oral herpes. Prevention. Even when someone is taking an antiviral drug for herpes simplex 1 and they are not currently having an outbreak, it is still possible to give the virus to someone else. So here are a few things you can do to lessen your risk of getting or passing on herpes simplex 1. 1. Do not share personal items such as toothbrushes and towels. 2. Do not share drinks or eat with the same utensils as someone else. 3. If you know that you have herpes simplex 1, avoid close contact such as hugging or kissing, especially if you are having an outbreak. And even if you do all of these things, prevention is still difficult due to the high prevalence of herpes simplex 1 in most communities. 56 to 76% of the general population have been infected by the herpes simplex 1 virus. A study done in Australia found that out of their sample group of 4,000 people, 76% tested positive for herpes simplex 1, and 12% tested positive for herpes simplex 2, which is genital herpes. Individual infection rates rise with age, meaning the older you are, the more likely you are to have been exposed to herpes simplex 1 and more likely to have been infected by it. This is due to the high prevalence in most communities. Most people with herpes simplex 1 infections will not have many problems as a result. They will have things such as cold sores and rashes and oral herpes, but this is more of an annoyance than a major problem. Although people with these infections need to be careful to not spread it and to not infect other people with herpes simplex 1. Complications are more likely to be found among people with a weakened immune system. Newborn infants are an example of this. While very rare, infections of herpes simplex 1 during birth have a mortality rate of 24%. As I said, I'm Brennan Puida, and that was the prevention and additional information portion of our presentation on herpes simplex 1.